We've been practicing sick care for long enough. We treat the disease after it appears, generic, reactive, and often too late. But a shift is coming. This week on Leaders in Healthcare, episode 81, we get a glimpse into precision health. Host Dr. Jordan Vollrath sits down with Raman Kapoor, president of the DIL Walk Foundation, to discuss a future where AI, genetics, and biomarkers drive personalized longevity. It all converges at the upcoming Precision Health and Longevity Summit, April 25th and 26th at the Hyatt Regency Calgary. This isn't just for clinicians. It's for the innovators in tech, health, and business who are ready to build a new task force for Canadian healthcare. Listen to the full conversation now. Then, secure your spot at www.dilwalk.ca. The future is precise.
This morning, we're joined by Raman Kapoor, president of the DIL Walk Foundation. How are you doing, Raman?
I'm doing great. How are you?
I'm doing awesome. Thank you so much for taking the time to join us today, chat a little bit about the DIL Walk Foundation itself, and as well the Precision Health and Longevity Summit that's coming up next month.
Yeah, I'm excited to be here.
Why don't you fill us in a little bit? How did the foundation come to be? What's sort of the backstory?
Absolutely. So DIL Walk Foundation is a local Calgary charity. DIL means heart in Hindi, Urdu, and Punjabi, but it's an acronym for Do It for Longevity. And when I co-founded this foundation, I was working in the space of building community capacity and looking at chronic disease management and prevention, and found that some of the underserved populations, so ethnic minorities, women, and children, often weren't getting the same kind of access to longevity or understanding of longevity as other populations. So the word WALK is actually an acronym for wellness, access, linkages, and knowledge. So DIL Walk focuses on those premises on how we can further longevity from a chronic disease management and prevention perspective. DIL Walk Foundation, what's kind of unique about it is that it's 100% volunteer run. So all our board members and all our positions are all based on volunteers. And whatever comes into the foundation, 100% goes right back into the community.
Amazing, amazing. And how long has the foundation been around for now?
So we founded it in 2011. And the nice thing, we do a lot of different community events. So one of our events that we did a few years ago was called the CPR 500, where we simultaneously trained 500 community members free of charge in CPR or hands-only CPR. And then we provided them with the machines or the kits to take home, with the premise that they would then maybe train their family members, train their neighbors, train their colleagues to spread that capacity on hands-only CPR training, which, as you know, is a simple life-saving skill. And the more people that know how to do it, the better the community is as a whole.
Well, that's incredible. Super valuable. Yeah, something I'm very personally familiar with. My family member actually went through a very basically died at one point and was able to be revived by the other family member present in the house doing CPR. So, wow. And he's fine now. But yeah, very personally familiar with this. So thank you for the work you're doing in the space.
Of course. Definitely a life-saving skill and one I think everybody should have access to.
And you yourself are a dietitian by background. How did you wind up getting into the chronic disease, the precision health, and the foundation side of things?
So, as a dietitian, I think I've been practicing for over 20 years, and my practice has always been on the premise of prevention. I think food, nutrition, lifestyle are the foundations of longevity, prevention, and management. So bringing that into a community perspective and into the perspective of, health span and technology and AI has been a very seamless interaction. So I think it's just something personally, nutrition or as a dietitian, whatever I preach, I also practice. So it comes very, very naturally to me.
And then when it comes to the Precision Health and Longevity Summit, when did this first start coming up?
So as you know, when we look at healthcare, even a practicing dietitian, and I used to practice, healthcare today is very reactive. We tend to treat the disease after it appears. We say healthcare, but we're actually practicing disease care. So I wanted to create some sort of platform where individuals that are involved in precision health and longevity and really focusing more on the precision aspect, because I think we've been practicing healthcare and medicine very generically. And now that we have access to tools that allow us to be more precise, I wanted to have a platform where individuals could come together, whether they be policymakers, health professionals, people who are interested in the space, functional medicine, to be able to see what innovations are happening and how they can integrate it into everyday life. And that's where the summit came about.
This is kind of the Achilles heel of Western medicine, right? Like the main critique is that it's sick care, not health
Yeah,
care. It's very reactive.
it is. It very much is. And, I think we have access to so many different parts of the healthcare system, and often we kind of get funneled or we get this tunnel vision on just one aspect. But if we were to bring in all these different perspectives and integrate them in, we would really be achieving quite successful healthcare. And that's what the summit is all about. So it's not only about health, it's about all aspects that affect our longevity.
And so, how would you sum up precision health? And then, how would you sum up longevity?
So to me, longevity is a big buzzword right now. And longevity is not necessarily just living longer or taking this product or taking that product to live longer. It's about adding not only years to your life, but life to your years. So it's about living longer well. And the precision perspective comes in that one size doesn't fit all. We're all unique. So how we handle our health and how we handle our lifestyle also needs to be unique. And as a dietitian, I can see that because if I'm working with a family with two siblings, I could prescribe the exact same nutrition kind of profiling to each one of them, same exercise, but the results are going to be different. So we really need to focus more on precision using things like genetics, biomarkers, blood samples, AI, technology to kind of bring that all together.
And so, precision health itself is sort of a newer facet of medicine. Like, this is definitely one of the kind of new kids on the block, the up and coming here. Tell me a little bit more about what kind of new and exciting stuff we're going to be learning about at the summit coming up.
So, we're focusing on AI-driven healthcare and diagnostics and biomarkers for early disease detection, longevity science, and aging research, really focusing on that personalized treatment. So we'll be hearing from a wide array of speakers, anywhere from specialists in health to AI, into data, lawyers, CEOs, all sorts of different facets of society will be talking about how longevity, how technology, innovation are coming together to seamlessly create this precision health science.
Are you a healthcare professional ready to take the next step in your career? Do you dream of a role where you truly make a difference in a community that's perfect for you and your family? Well, then let me introduce you to Cherry Health. Our platform puts thousands of healthcare opportunities right at your fingertips. Explore jobs by location, specialty, compensation, and more. All on an intuitive map-based platform, available on Android, iOS, or your computer's internet browser. Create your professional profile for free and get started messaging directly with employers. Beyond the app, Cherry Health also offers personalized, white-glove recruiting services who can guide you every step of the way. Your dream healthcare career is just a click or a phone call away. Visit www.cherry.health to start the next phase of your journey.
And so I get the sense that it's not just an event for clinicians, like researchers, the business admin, anybody involved in the sector.
You're right. It's not just for healthcare workers. Healthcare workers definitely would benefit, but it would benefit anybody who's in any realm of longevity, whether that be the financial sector, whether that be in accounting, whether that be in law, whether that be, in the area of technology, AI, growth. So I think all different sectors would benefit from coming to the summit.
And so this is coming up next month, April 25th, 26th, correct, in Calgary?
That's correct. It's a Saturday, Sunday at the Hyatt Regency.
What kind of format should we expect for the sessions, the seminars?
So we'll be looking at a number of different formats. There'll be keynote speakers, there'll be panels, there'll be fireside chats. There'll also be some conversational style things, as well as some different areas where we focus on doing maybe an active or involved kind of portion.
Okay, awesome. And then how long does the actual event run on both those days?
So on Saturday, it starts at 8 and it runs right till 4. And then on Saturday evening, we do have a VIP reception. And then at Sunday, we start at 8 and it goes till about 2 in the afternoon.
Okay, incredible. And then how many years has the summit actually gone on for?
So there was a Precision Health and Longevity Summit last year. This is the first year that DIL Walk Foundation will be hosting the summit. And so, yeah, for DIL Walk Foundation, it is definitely the inaugural year for it.
Okay, incredible. And what have you learned from last year? What's going to be new and exciting coming up this time around?
I think one of the biggest newer learnings or newest pieces that'll be with this is the wide variety of speakers that we've got. The speakers we have range from so many different topics of expertise and ideas that when I think they come together, the synergies that we will be building will be pretty phenomenal. We are super excited to have all these wonderful people come together and share their expertise.
Okay, incredible. And are you at liberty to name drop any of the speakers at this point?
Absolutely.
Give us a little sneak peek.
Well, let me think. I'm trying. Dr. Giovanni Ferrara will be coming in from the University of Alberta. We have Tori Hibbett joining us. Wish Bakshi, Dr. Raja Mehta from Alberta Innovates will be speaking. We've got Dr. Ahmed Al-Sahami from Nutrigenomics. He'll be coming in from Toronto to speak. We've got Jocelyn Rempel, who's the chair in older adult health. We've got Dr. Igor Kowalchuk from the University of Lethbridge. Crystal Phillips, Senior Director from Opportunity Calgary Investment Fund. Tara Cowling, who's the founder and president of Medlior Health Outcomes. And Dr. Genevieve Burley, who is the founder and clinical director at Longevity Expert coming from BC. So you can see that we've got a real wide array of expertise and speakers coming to the summit. What I do is suggest people to visit www.dilwalk.ca, where they can see the full lineup of speakers there.
Okay, amazing. Yeah, definitely some familiar names in there. It sounds like an exciting lineup.
Yeah. We're hoping to get as many people as we can out because the more diversity we get in terms of individuals there, that's where we're going to build the collaborations and that's where we're going to really build the capacity. So really longevity is about building capacity and collaborating and finding the synergies to help us continue to grow forward. One of the foundation's bigger goals from this summit is actually to see if we can create a task force that looks at precision health and longevity and integrating it into the system. So finding those groups of individuals that we can pull together as a task force and really seeing how we can now start to move the agenda forward.
And how is precision health accessed right now? Like, is it very kind of helter-skelter and mosaic patchwork of clinics and providers and companies? Or how do we actually start pushing towards that more cohesive system?
Well, I think that's where right now it is very patchwork. You know, there's some different clinics that will offer precision health. There's some different providers, different practitioners where you may be able to access that. But when you're saying how can we make it cohesive, and I think that's where it comes down to a policy level. That's where we need to be getting change makers in, policymakers in, different government officials in, where we're able to now integrate it into the system. There's wonderful things happening, and there's some great innovations and technology that have come forward to actually help move precision health to a more proactive solution versus a system being so reactive. Now the piece comes in is how do we increase the access? How do we democratize precision health so everyone and anyone can understand it, utilize it, and actually become the CEO of their own health?
Okay, so anybody attending, bring your business cards. It's going to be a great event for networking.
Absolutely. Anybody who does register as a participant, because we are doing it through the DIL Walk Foundation, a portion of the registration will come back to them as a tax receipt.
Okay, awesome. Good to know. And then would this qualify as like CME credits, the ongoing education side of things?
So although it won't give exact CME credits, you know, there will be a certificate of attendance as needed for individuals.
The summit is coming up on April 25th, 26th at the Hyatt Regency here in Calgary. Anything else we should know about the event?
Absolutely. You know, events like this are not possible without our partners, our collaborators, our sponsors who always help to bring this together. So I want to definitely give a shout out or a thank you To all our partners, collaborators, and sponsors, such as Cherry Health, thank you so much to Cherry Health. They've made this absolutely incredible, and their support and partnership in this. Other partners include Bio Alberta, Alberta Innovates, Tech Connect Alberta, Tech Thursday, Calgary Petroleum Club, Alberta Blue Cross, LexisNexis, RBC Desai Wealth Management, Opportunity Calgary Investment Fund, Myomar Molecular, and Hemostemics. So we are so thankful to all our partners and supporters and collaborators to help make this a successful event.
Amazing. It really does take a big team of people to put something like this across the line. And yeah, it's been an honor for us to be involved. So thanks so much for having us. And thank you for joining us today. Really appreciate you taking the time to chat more about the summit.
Thank you again. And thank you so much for having me. And thank you again for your support.
Anytime. We'll have to do this again.
Absolutely.